Hello everyone, welcome back to our channel. We are doing the neuroanatomy lectures. We have already covered spinal cord, medulla oblongata, pons. Those who have not seen that videos, first see that videos so that you will be able to follow this topic, cerebellum. Cerebellum is an important topic for the first MBBS exams in the neuroanatomy questions. As it is a big topic, I would cover this topic in two videos. Now in this video part 1 and this will be followed by the part 2. You see both the videos, then only you will be able to present in the exams. Those who have not subscribed to the channel, do subscribe now so that you will have the notifications of the upcoming lectures. So from this neuroanatomy, we have introduced the interactive videos. Same like that, in this video also we will have the pre-test, quiz in the middle, and also the post-test and clinical scenarios also. So do watch the entire video and assess yourself. So we will move on to the topic cerebellum part 1. If you see the signs of the cerebellar damage, there are many. There are many mnemonics also to remember this. One is this Danish. If you have heard this mnemonic, so I am telling the other mnemonic to remember this cerebellar damage: vanished, vertigo, ataxia, nystagmus, intentional tremor, slurred speech, hypotonia, exaggerated broad-based gait, and dysdiadokinesia. So all this is you should have learnt in neurophysiology also. So if the cerebellum is affected, we have many signs and symptoms of the cerebellar damage. So that we can remember by this mnemonic vanished. So this is the pre-test for you. Do you know the anatomical subdivisions, morphological subdivisions and functional subdivisions of the cerebellum? Have you learnt in any other neurophysiology topics? Then it will be easy for you to follow this neuroanatomy also. So the main objectives of this class is you should be able to know the anatomical subdivisions, morphological subdivisions and the functional subdivisions of cerebellum after we cover this topic. In this part 1, we will mainly see the anatomical subdivisions. If you see the part 2, then you will be able to understand the morphological and functional subdivisions of the cerebellum. First, we will start with the introduction to the cerebellum. Introduction to the cerebellum, it is the part of the hindbrain. You know it is a part of hindbrain, pons, medulla and cerebellum, situated in the posterior cranial fossa below the tentorium cerebelli, behind the pons and medulla. It is separated from the pons and medulla by the cavity of the fourth ventricle. So this is the base of the brain. You are seeing the cerebellar hemispheres on both sides here. So that is the situation of the cerebellum. It is situated behind the pons and medulla in the anatomical position. Here this is turned down to show us the base of the brain. So we can't correlate here the situation of the cerebellum with this image. We have to see the next image. So this is separated from the pons and medulla by the cavity of fourth ventricle. So this is related to the pons and medulla but separated by the cavity of the fourth ventricle. So this is how we have to understand which is dorsal. This is dorsal and superior. So this is dorsal, this both parts will be dorsal and here will be the ventral and this will be also the superior and inferior. This dorsal and ventral we are telling this in relation to the development of the neural tube. So you can now understand the cerebellum is situated behind the pons and medulla. So this is dorsal and this is ventral. Behind the pons and medulla, separated by this cavity of the fourth ventricle. So that is the situation of the cerebellum. So like this, rostral to caudal. So this also will be called as anterior and posterior. This is the floor of the fourth ventricle. We have already seen in the class on the medulla oblongata and in the pons. Here the cerebellum is removed. So this cerebellum is separated from the pons and medulla by this cavity. This cavity is the fourth ventricle. So we have introduced the cerebellum. Now second is the cerebellar peduncle. Cerebellar peduncles are three in number: superior, middle and inferior. Inferior connects it with the medulla oblongata, middle connects it with the pons and superior connects it with the midbrain. So in this picture all peduncles are shown, you can appreciate. So this is the superior peduncle and this is the inferior peduncle and this is the middle peduncle. We have learnt already. So this is the inferior peduncle and this is the middle peduncle and here is the superior peduncle. So now the quiz for you: which cerebellar peduncle forms the infrolateral boundary of floor of the fourth ventricle? So if you are able to answer this, then it is great. So which cerebellar peduncle forms the infrolateral boundary of floor of the fourth ventricle? So we have completed the cerebellar peduncles. Now in this part 1 we will see the gross anatomy of the cerebellum, otherwise surfaces of the cerebellum, and the anatomical subdivisions of the cerebellum. So before we start with the anatomical subdivisions and gross anatomy, we have to know how the cerebellum is arranged in nature of grey matter and white matter. Consists of grey matter at the surface and medullary core of white matter. Same as the cerebrum and cerebellum, they have the grey matter at the surface and medullary core of white matter. The remaining parts will have the grey matter in the center and outer white matter. Same like spinal cord, but except this cerebrum and cerebellum. 4 pairs of deep cerebellar nuclei will be present. They are the grey matter again in the medullary core. So this is outer grey, inner white, and in the inner white again grey matter, 4 pairs of deep cerebellar nuclei. So what are the 4 pairs of nuclei? If you see, nucleus fastigius, nucleus globosus and emboliformis and nucleus dentatus. We will see in the picture, then you will be able to understand. So before we see the picture, do you know anything about the cerebellar nuclei, which is purse-like? It has the shape of the purse-like this. So it will be like this. So do you know the name of which cerebellar nuclei is like this? If you know, it's great. So here is the section of the cerebellum which has the nuclei also. You can appreciate from here. F is the fastigial nucleus. So this is fastigial. Then E is emboliformis and this is D is emboliform, E is the globus nucleus and G, this is the dentate nucleus. Now you should have seen in this, which is like this purse-like, is the dentate nucleus. So you should recollect which one more nuclei we have seen in the sections of medulla oblongata in this shape also. Can you able to recollect? Oh, you are great now. So what is arbor vitae cerebelli? So if you see this white matter entering into the central axis of each folium. So this will be called as the folium. So this will be called as the folium. In this outer grey matter and inner white matter, they enters this each folium resembling like the branching of a tree, hence called arbor vitae cerebelli. Now we will start with the gross anatomy and anatomical subdivisions. Cortex is thrown into numerous folds or folia separated by the fissure. Posterolateral fissure is the first to appear during embryogenesis. So this is cerebellum is divided into parts by the fissures. We have to understand. So the folds are called as the folia. Folia and fissures provide large surface area for accommodation of numerous neurons in the limited space. If you see the sulci and gyri of the cerebral hemispheres, like that in the cerebellum we have the folia and the fissures. Anatomical subdivision. So you have to note this heading so that sometimes you may be asked separately. You may be asked cerebellum as an essay, or so many subdivisions we are having that may be asked as short notes. Now anatomical subdivisions consists of two large cerebellar hemispheres, and the middle part will be called as vermis because it is worm-like. So now you can see in this picture, these are the cerebellar hemispheres. This middle constricted part will be called as the vermis. So now again it's the quiz time. Which cerebellar fissure is the first to appear in embryogenesis? Do you able to answer this question? Yes, awesome. Now there are two surfaces of cerebellum. So that separating the surfaces is the horizontal fissure. So now in the previous picture you have seen one surface, another surface is just below that. That border what you see is the horizontal fissure. Superior vermis is continuous with the superior surface, but if you see the inferior surface, it is not continuous, it is separated by the furrow called vallicula. Same like foramen cecum, vallicula, you should have learnt in many places. Even in the tongue, the vallicula is present. So you have to recollect this vallicula again. So this is the superior surface. This is superior surface. As I was telling, this is the transverse fissure, which is dividing this cerebellum into two surfaces. So this part, the border, is the transverse fissure. So this is the transverse fissure. This is superior surface and this is vermis. You can see both are continuous on the superior surface. So this fissures divides the surface into lobes. So in the anatomical subdivisions, we have to start with the fissures, surfaces, then with the lobes. So the first fissure which is appearing, that is the posterolateral fissure, is first dividing the cerebellum into a small caudal part that will be called as the flocculonodular lobe. And the rostral part will be called as the corpus cerebelli. So we have now two parts, first two lobes, flocculonodular lobe and the other part that is called corpus cerebelli. This corpus cerebelli, that means it is on both surfaces, superior and inferior. Is dividing this both surfaces into two lobes, anterior and posterior lobes. That which fissure separates this is the V-shaped primary fissure. That is the fissure which separates the anterior and posterior lobes. So now we will start with the superior surface. In the superior surface, we have the anterior lobe. So that parts which are present in the anterior lobe are the, we are telling which part is present in vermis, corresponding part in the cerebral hemisphere also. Lingula does not have the lateral projection. The part central lobule have the cerebellar hemisphere projection, that is ala. Culmen, that is having the part which is in the cerebellar hemisphere as the quadrangular lobule. So this is now, after this we have the primary fissure which is V-shaped. So up to this will be called as the anterior lobe, which is present in the superior surface. You have to note still some parts are present in the superior surface, not only the anterior lobe. We are continuing after the anterior lobe. posterior lobe. So this part, some parts of the posterior lobe are present in superior surface also. They are decline and corresponding lobulus simplex, folium vermis, superior semilunar lobule. So now comes the horizontal fissure which divides the cerebellum into superior and inferior surface. So the parts of the posterior lobe are continuing in the inferior surface also like this. So now these are the parts we have learned. So many parts we have learned. So again it is marked in this. You can, so this part of vermis, first part, ala is not having this lateral projection. Other parts are having the lateral projection. So now we are continuing with the posterior lobe on the inferior surface. Posterior lobe on the inferior surface contains the tuber vermis and the corresponding part is the inferior semilunar lobule and the pyramid and the biventral lobule. So now again the quiz time for you. We have two questions. In which surface of cerebellum secondary fissure is present? Are you able to give the lateral extension of the central lobule of vermis? Okay, you check yourself. Then we will move on to the continue with the posterior lobe. So these are the parts of the vermis and cerebellar hemispheres on the inferior surface. They are labeled like this. You should be able to draw a neat labeled diagram of both surfaces, including the fissures and the corresponding parts of the vermis and cerebellar hemispheres, with the clear indication of the anterior lobe and posterior lobe and flocculonodular lobe on both surfaces. Now we are continuing with the posterior lobe on the inferior surface. The last part is the uvula and tonsil. Then comes the fissure, secondary fissure, which separates the posterior lobe from the flocculonodular lobe. So we have fissures, surfaces, lobes in the anatomical subdivisions of the cerebellum. So we have completed the anatomical subdivisions of the cerebellum with so many interactive quiz in the middle. I think you should have understood it completely, and we will continue with the functional and morphological subdivisions in the part 2 cerebellum. So we have to now summarize which surface is this. Are you able to identify these both surfaces? How to identify if the vermis and surfaces are continuous? It is the superior surface. If they are separated by a depression, then this is the inferior surface. We have learned so many parts of the vermis and the corresponding parts of the cerebellar hemispheres in this anatomical subdivisions, and the fissures which separate the anterior lobe, posterior lobe and the flocculonodular lobe. The fissure which separates the superior and inferior surfaces we have learnt in detail. So we have completed the summary of the cerebellum part 1. Now it is the post-test quiz time for you. We have 4 questions. So do answer these 4 questions and assess yourself. We have completed the anatomical subdivisions in the part 1 cerebellum. We will continue with the morphological and functional subdivisions in the part 2 cerebellum. You follow that video also so that you will be able to understand the complete neuroanatomy of the cerebellum. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos. Thank you.